When I diagnose type 1 diabetes, I talk to patients about the fact that they don't make insulin and that their elevated blood sugars are not their fault. When I talk about treatment, I have to point out to them that it has to be insulin therapy because their body does not make it. There's no other thing that I can give them to encourage their body to make more insulin.
Typically, patients with type 1 diabetes will administer insulin injections to themselves. They can also use an insulin pump, which is an insulin delivery system that delivers continuous insulin. And in some cases, for mealtime insulin, they can also use inhaled insulin. There are many different insulins available for patients. They're primarily characterized by how quickly they're absorbed, how quickly they take their peak effect, and how long they act. A type 1 diabetic needs to use at least 2 different types of insulin. They need to use a basal insulin, which is a longer-acting insulin, and that's used to control their blood sugar overnight, fasting, and in between meals. They'll also need to use a more rapid-acting insulin that can cover their blood sugar spikes when they eat meals or snacks.
I take a long-acting and short-acting insulin throughout the day. I ultimately found the right levels and dosages and type of insulins that work for me, and I'm very happy with how it's transitioned.
Blood sugar monitoring is important in type 1 diabetes, as it is in any type of diabetes, but especially type 1 because these are patients who are dependent on insulin. And because insulin lowers blood glucose, which is why we use it, sometimes it can lower blood glucose too low. So making sure the blood glucose levels are in the target range is really important to success. Blood glucose is measured through a blood sugar meter, which is called a glucometer, and will display a reading and will tell a patient what their blood sugar is in that moment in time.
I use a continuous glucose monitor, which has been a lifesaver for me. It provides me with information every 5 minutes in terms of where my blood sugars are at.
Patients with type 1 diabetes should be checking their blood sugars several times a day, minimally before each meal and before bedtime. Fasting blood sugars should be less than 100 to 130, and after meals, blood sugar shouldn't exceed 180 in order to maintain a reasonable level of control.
Someone with well-managed type 1 doesn't have a lot of blood sugar variability throughout the day, so they're not 40 1 minute in terms of blood glucose level and 400 the next minute.
Their A1C levels are on target, they have normal blood pressures, they have normal cholesterol levels, and they feel comfortable managing their diabetes.
Where are we going in terms of treatment with type 1 diabetes? Well, there's the artificial pancreas, which is the holy grail of type 1 diabetes treatment. Other things to think about are pancreatic transplant and islet cell transplant. Another hot topic in type 1 diabetes is the development of a vaccine that maybe could prevent type 1 diabetes from forming in children. We'll certainly have better ways of dealing with the insulin need, but to eliminate the need altogether is a pretty far reach.